Thank you, Mr. Chairman. Congratulations on your assumption of the chairmanship of the committee and the ranking member. I want to just emphasize a couple of points you've already discussed. One is transition with the chairman. Critically important, and there are a number of bills out there, the TAP Promotion Act, Welcome Home Veterans Act, Combat Veterans Pre-Enrollment Act. I suspect you're familiar with them, but I just want to hear you reiterate your commitment to this transition and working with the Department of Defense, because it's a partnership that has to happen to make that warm handoff. Is that going to be a priority for you?
Yes, Senator. You couldn't have there are so many priorities in the life that you look at, you want to get started, but this one that you hit about making this transition is so important to me because it transcends just getting them into the service. It transcends that benefit that they've earned. It goes to the very heart of making sure that they're taken care of and feeling wanted. As we started a little while back, I believe it starts at a recruitment issue all the way through a retirement issue. Because if they feel like they're taken care of in DOD, then they're going to have a better opportunity if VA reaches out with a hand to say, here's the benefits you want to participate in, that they have a place there and they have a facility for them. The concern I have, Senator, is making sure that in DOD, and I've already had some look at this, is how we can do some cooperative work with the DOD and the VA. Also bringing into account the state veterans associations as well.
I
understand.
I want to emphasize that last point. I've had a proposal in the National Defense Authorization Act, gotten in the Senate, got knocked out in the House, to communicate a veteran's transition status to the state veterans facility so this person can be greeted at the airport, for example. That's the kind of handoff that I think we want. Do you agree?
I agree. Look, because it's exactly what you said. It's how you're perceived. I view the service part of the VA is its most important part. There are some times that you have to tell somebody no. There's sometimes you have to tell them we can't do something in a benefit or something else. But there's always time to make that veteran feel like they are cared for. And I think the transition time, which you're talking about right now, that sort of, as you said, that warm hug, is the thing that we need to actually look at.
And it's a critical moment, as you pointed out. It's a time of heightened risk of suicide, yes, for example. Let me move on. Electronic health record, you had some discussions. I think this points out one of the fundamental flaws in the federal government procurement process, particularly in national security areas, where we feel we've got to buy our own custom, brand new, shiny product rather than something that's sitting on the shelf. There's a electronic health records system called Epic that thousands of hospitals use all across the country. Instead, we're trying to invent our own system, which frankly hasn't worked and, as you pointed out, has cost billions of dollars. I hope that you'll look at the option of saying, hey, let's go with something that works, that we know it works, and can be modified to meet our needs, rather than continuing down the road of billions of dollars of a system that has so far not proven itself.
Yeah, Senator, I think that what you've just hit is I don't, not going to, what I'm committed to is making sure what we have and looking at all options on the table. I want to bring in, because Cerner and others have, Oracle has had, places where they already have facilities already running the program. It's the issue that I went back to earlier, and I think you heard it was here. The VA is special but not unique. We've got to get out of this uniqueness status. And how is it different than the largest healthcare organization like this that there are not better ways that we can do it? And it's not just in medical health records. We've got to look for better ways all across.
That's exactly my point. A lot of discussion this morning about the Mission Act and community care. I'm all for it under the appropriate circumstances, but not at the expense of a creeping elimination of the veterans' health care system. I believe I heard you say earlier you remain committed to VA health care in addition to community care where appropriate. Is that correct?
Senator, you've heard correctly, because I believe that there'll always be a VA health care for the veteran who comes out. I believe what we have to do is make sure that we are adapting and making sure that we are giving the care as authorized by this body to make sure that we do it in the ways that are appropriate to the veteran. It's no longer time in the situation different, especially in different parts of the country, where we have to have the veterans to do the mission and what the intent was when we passed it.
You mentioned that you had not read Project 2025. Are you familiar with it? There are some suggestions in it that, frankly, I find pretty frightening.
I'm not, except for what I've heard when senators mention or somebody says it on TV.
Well, for example, there's a provision that new managerial approaches should be currently used in the private sector to be employed to improve the existing VBA activities. I'm afraid that might be code for sharks, for claim sharks. Are you supportive of the Guard VA Act? Are you familiar with that bill?
I'm vaguely familiar with it. Yes, I have touched it.
Well, I hope you'll familiarize yourself with it. I think it's a very important bipartisan bill to protect veterans from what are colloquially referred to as claim sharks. I'll have some other additional questions later in the hearing. Thank you, Mr. Chairman. I want to make something very clear. I don't want AI to decide if one of my veterans is entitled to the benefits they've earned, period. Capiche?
Senator, there's no veteran that is going to miss the benefit that they earned by the position and the way they process their claims. But I think you and I will both come to a conclusion that if there are better ways to process a claim that our veterans can get their benefits quicker, then I'm willing to look at any opportunity to get their veterans' benefits quicker. And if that involves AI, then I'm not willing to take it off the table. I'm not willing, though, to have them put in a position where AI is randomly in a situation, especially with benefits and others that are more difficult. There'll always be a person there to oversee that process.
Well, the experience thus far with AI in the insurance industry is not positive. And I don't want our veterans having to go through a claims litigation in order to overturn the decision of a machine somewhere. So I understand you're not willing to take it off the table, but I certainly hope it will be handled with great care, because it will be very tempting to reduce staff and replace it with this technology. But I'm not confident in the technology right now to be making these life or death decisions for our veterans.
Yeah, I understand and respect your position, Senator. I do not view this as a life or death decision. I think these are decisions that could be made in how we look at the best efficiencies. And look, there'll always be, in my mind, especially when it comes to the veteran benefit, someone that overlooks and oversees that as well to make sure that it is working properly. If it went that way.
Thank you. You're going to be under tremendous pressure as we move into this difficult budgetary situation, and there's a lot of pressure to reduce the budget. I think it's been pointed out here, the Veterans Administration is one of the largest pots of money in the federal government. It's very easy to focus on the bureaucracy, that term, which carries with it a kind of negative connotation. But I would point out that in many cases, staff cuts equal benefit cuts, because if there's nobody there to answer the phone, or if the process is delayed to the point where the veteran dies or just gives up, that's in effect a benefit cut. So as you're under this pressure, and I believe you will be, I hope you'll take care to balance necessary efficiencies against the loss of services. You've said repeatedly, and you said in my office, and I love it, you don't want us to have to be advocating for our veterans because they ought to get their benefits without having to come to a congressional office. Well, if staff cuts end up having nobody answer the phone, or answer the phone after only 100 rings, or say, we'll have to talk to you 6 days from now or 6 months from now, that's going to only aggravate the problem, and you're going to be hearing from us on a daily basis instead of every other day.
I think, Senator, your point is taken, and I understand. I think the interesting question is these very things arise right now at the staffing levels that we have. I think there's more of an issue here. Are we doing things as efficiently and processing as we can with the staffing that we currently have, whether that's more or less staff? I think sometimes you have to look at the process. I mean, why is it that we're back up at 250,000 backlog of benefits when we've had 130 billion in increase in funds and 70,000 employees? That's just something's broken about that.
I agree, and I commend you for wanting to follow up on that. And I have no problem with efficiency, and I think I can't complain about a hiring freeze. I actually signed a hiring freeze in my inaugural address as governor. So I understand that. On the other hand, I think the point that Senator Blumenthal was making, the hiring freeze should not apply to direct care workers. If my Togus Hospital in Maine needs a cardiologist and it's been open for a couple of months because they're hard to find, this hiring freeze should not prohibit them from continuing to search for, and if they can find a cardiologist, to sign them up. I hope you'll distinguish between direct care workers and others who serve veterans behind the scenes.
Thank you, Senator. If confirmed, we're going to always make sure that, as I've said many times before, no matter what the issue is, I will always fight for making sure our veterans are getting the care in the proper way that they need to.
Final point, there's no answer necessary for this, but one of the things you're going to be having to face is increasing demands for mental health services and long-term care. long-term care as our veterans age is going to become a greater and greater issue. The Elizabeth Dole Act starts to address that, but I just commend that to your thought process, and perhaps you can have people thinking about this. How are we going to provide those services that are going to become more and more necessary as time goes on?
Thank you, Senator. I appreciate the things that are already keeping me up at night if confirmed about this job. I appreciate you giving me more. But I also look forward to reaching out to you for help in that as well. I do
Thank you.
appreciate it.
I commend you for your participation this morning. Look forward to supporting your nomination.
Thank you so much. Appreciate it.